Far too many tri-state residents struggle to pay for prescription medicine and to find affordable health care. The Green River District Health Department offers a program that can help. Suzanne Craig is the program manager. Latoya Sibley is an advocate for the Community Access Project. Hi, ladies.
Hi.
Welcome.
Thank you.
This is exciting to read about. So, Suzanne, can you kind of give us the history behind this project?
Sure. About a little more than almost 14 years ago, our community came together and they decided that too many people were showing up to the emergency room without access to prescriptions, without access to a lot of medical care and so forth. And so our project came, the health department took lead at that point with an evidence-based practice of looking for solutions to access to care problems. Almost 14 years later, we've now, I'm happy to report, have done more than $63 million worth of prescriptions to help folks.
That's phenomenal to think about.
Thank you. We're so proud. And really, we couldn't do it without the support of many of our grantors and the support of the health department, really believing in understanding the access to care concerns in our community.
I think it's one of those things, and Latoya, you can speak to this, we read about it all the time. It's always one of the top stories in the news, but when it becomes personal is when it really does resonate, isn't it?
Yes, ma'am. When we are able to do what we do and people come in and they're able to get their medication for free and can pay their rent and buy groceries because we was able to get their medication for free, it's a blessing. It makes us feel proud of what we do.
For folks who are watching today and they feel like they'd like to be a part of this, what is the process like to get in on your radar and get the help they need?
Well, they need to call for an appointment so we can tell them what documents that they need to bring, and then we'll sit down with them and we'll look at pharmaceutical programs. We'll see what doctors they're going to. In some cases, they maybe said, I need to be on insulin, but I'm not seeing the doctor in a long while, and I need to get back in to see the doctor. So we're doing all kinds of case management help to help people live a healthier life. And so we work closely with the medical community. They're signing the applications that we turn into the pharmaceutical company. So we work with more than 700 different physicians and nurse practitioners that trust us to help them advocate for the patients.
Well, that's a vital partnership. I mean, you have to have that trust and that communication, exchange information. So is there an age limit on this program?
There's really not. And so it could be anyone from a senior to someone who maybe is in their working years. It could be all different ages. It's based on often the diagnosis. That we know in our community, diabetes is the fastest growing diagnosis throughout the state and our community. And so with that alone, a person who's making an average household income, like for Davis County would be about $46,000 a year, would be at a deficit of about $7,000 a year. At the end of the year, they would be negative $7,000 if they had even diabetes. So even making an average household income, you might think, well, I work and I make an average household income, is not enough if you get a really chronic diagnosis like diabetes.
And almost no matter what your income is, if you're in middle America, a health diagnosis that is a negative can clean out your bank account.
Yes, and diabetes, insulin has gone up 300% in the last 3 years.
Yeah.
And so the average person does not make 300% more. And so we're very sympathetic. We don't shame people. There's reasons that people fall in the gaps for no fault of their own.
Of course. And I know you hear those stories, Latoya, being an advocate.
Yes, I do. I actually had a client to come in and he was like, Latoya, I need help. I was like, okay, that's what I'm here for. What can I help you with? And he was taking Trulicity and it was like $500 a month. He was like, I can't afford it. It's no way. And he had Medicare Part D, but he was in the donut hole. He was in the gap. And when you're in the gap, you have to pay full price. And I was like, well, let's sit down, let's get the paperwork in, let's get contact with the doctor, and let's get this medication. So when he started getting it free, he come back, him and his wife, he was like, we so grateful, we owe you. No, you don't owe me, because I love doing what I do. This is my job, and I want to be able to help you. Do me a favor, just tell other people about the program.
Well, those are the outcomes we want to hear. We want to hear those stories, and I know you all hear them all the time. The best way to contact you is through the Green River District Health Department?
It is, and so we'll get you, we have 5 different projects in different counties, but we'll get you to the right county. We're going to give you one number, 270-852-2904, and so that they can call, and then we'll tell you what documents to bring. We'll research and tell you if that medicine's available to you. We'll treat you with a lot of dignity.
Thank you both. That's good news this holiday season and beyond.
Thank you,
ladies.
Thank you.
We'll be back. Let's check in with Ron Rhodes, see what he's got to say for himself.
I say that we got the sunshine coming through the clouds and no snow falling from the clouds now. The full forecast coming up.